A major health alert. Every year in the U.S., an estimated 400 families are devastated by the sudden death of a toddler or young child, often with few answers. But a new study has found a possible cause. Here's Kate Snow.
Katie Schakowsky-Fell and Justin Fell have two beautiful children, but their youngest, Cammie, used to have a twin brother, Hayes.
Tell me about Hayes.
He was one of the happiest little boys that you'd meet. Loved to dance.
Loved to dance. You would tell him, say, give me a wiggle, wiggle, and he'd go.
Try it, Hazy.
Right before his first birthday, Hayes had a seizure accompanied by fever, what's called a febrile seizure. He had 4 more in the months that followed.
What were those months like for you guys?
Exhausting, terrifying.
What were the doctors saying?
All of them said to us, they're simple febrile seizures. He's going to grow out of it. I had one doctor look me in the eye and say, if he's going to have a seizure, this is the one you want him to have.
In November 2022, they sang to Hayes and his twin at bedtime. The family's baby monitor camera captured the moment.
I love you.
The next morning, Justin found Hayes in his crib, not moving.
I mean, we both sat on the floor next to our kitchen, our refrigerator, just holding our heads in our hands. You can't process reality.
I just remember saying over and over again, I don't understand. I don't understand what happened.
It's a healthy 17-month-old boy.
He was fine.
Yeah.
And that's all I kept saying to him. I go, he was fine last night. Why didn't he wake up?
They joined a registry of more than 300 families with a sudden, unexplained death of a child, started a decade ago at NYU.
I've been looking for the answers for 25 years, and we are finally finding the answers.
Research assistant professor Laura Gould was driven by her own story.
In 1997, my 15-month-old daughter, Maria, did not wake up, and no one could answer my questions or explain what happened.
In a new study published in the medical journal Neurology, she and neurologist Dr. Oren Davinsky zeroed in on the Fells and 4 other families who had continuous video from crib cameras the night their toddlers died.
We found a smoking gun. We found in the cases where we had good recordings, clinical evidence of a convulsive seizure.
Febrile seizures affect up to 4% of children 6 months to 6 years old in America. Deaths are extremely rare.
Doctors often tell parents that these kinds of seizures are not a big deal. They're going to be okay. Should they change that message?
I think they should change it a bit and say there's an incredibly tiny risk that there could be a death related, and there might be preventive measures if you wanted to take them.
There are devices and wearables like socks to monitor children's oxygen levels during sleep. The Fells wish they had known for Hayes.
If parents can be warned that this is a possibility and they can be given that opportunity, like I would give anything to have had that opportunity to try and save him. If he can help give other parents that opportunity, that's a beautiful legacy for him to have.
They hope this new study ignites more research to save other toddlers. Kate Snow, NBC News, Baltimore.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.